I think if I had to roll it up, I would say that there are legal rights and obligations to implement health service delivery for people with obesity, and representing the 20,000 plus health professionals that I do across AR, so the European Association for the Study of Obesity, in 36 different countries. We have legal rights and obligations as well. And so my key message has been to make sure not to have a conversation all the time about only prevention or only different types of treatment, but to actually look at how can we have a health system which is fit for purpose. So yes, prevention, 100%, but what about that almost 60% where prevention or primary prevention is no longer an option? We need a system which is fit for purpose, and actually public administrations have a legal obligation to provide it. So not quite a runner-up, because that would be not very neutral. I would say that in policy terms, Portugal has been named one of the so-called front-runner countries, so actually a trailblazer in terms of, at least on paper, making sure that there is a health service delivery system that is fit for purpose for people living with obesity for the long term. So in Portugal, I'm so excited because I've been working with our national association very closely from a European and then Portuguese perspective. And on paper, Portugal was the first to have a national strategy that actually included health service delivery. The realities are, yes, there's now a renewed action plan, great, at the end of last year. The next step would be to say, how well trained are health professionals in order to deliver it? How well trained or how good is the infrastructure in order to deliver it? Are people with obesity knowledgeable about their medical condition? Do they know that they actually are entitled to the right treatment for them at the right time? Is there sufficient reimbursement? If there isn't now, then what's the plan? So, it swings and roundabouts because Portugal is really far ahead, but the baseline is low.